Hello everyone. Today, we are going to talk about aortic regurgitation. It comes under diseases of heart valves. So, before coming into the valvular heart diseases, let's talk about the heart. So, what is the heart? Simply, it is a muscular organ located in the chest cavity, which pumps the oxygenated blood throughout the whole body. The heart is the organ that works constantly during the whole lifetime. The heart has four chambers, namely, the right atrium, right ventricle, left atrium, and left ventricle. And, there are four valves are placed between the cardiac chambers, and from the cardiac chambers to the opening of great vessels. These cardiac valves prevent the backflowing of the blood, and act as one-way inlets and outlets of ventricles. From the right atrium to the right ventricle there is the tricuspid valve. From the right ventricle to the main pulmonary trunk there is the pulmonary valve. And from the left atrium to the left ventricle, there is the mitral valve, which is also known as the bicuspid valve. And from the left ventricle to the aorta, there is the aortic valve. The tricuspid valve has 3 cusps, and the mitral valve has only 2 cusps. Both pulmonary and aortic valves made of 3 cusps, and they are also known as semilunar valves. So, today we will be talking about the regurgitation of the aortic valve. In aortic regurgitation, there will be backflow of blood from the aorta, through the aortic valve into the left ventricle, during diastole. Diastole is the period when the ventricles relax after contraction. This happens because the aortic valve does not close tightly during diastole. Usually, cardiac valves are closed tightly to prevent the backflowing of blood. When diseases are affecting the aortic valve and the root of the aorta, there will be damage to the aortic valve. The causes of aortic regurgitation are rheumatic heart disease, infective endocarditis, syphilis, aortic dissection, severe hypertension, and congenital diseases like Marfan syndrome and osteogenesis imperfecta. In infections like rheumatic heart disease, infective endocarditis and syphilis will damage the aortic valve, and therefore it affects the tightness of the aortic valve. In both aortic dissection and severe hypertension, there will be dilation of the aorta, affecting the aortic valve. Marfan syndrome is a genetic disorder that affects connective tissue. Those with Marfan syndrome tend to be tall, thin, and long limbs. Also, commonly they have cardiovascular abnormalities. Osteogenesis imperfecta is also a genetic disorder, and it prevents from building strong bones. These bones will be brittle and will break easily. Now, let's talk about the pathophysiology of aortic regurgitation. So, as I mentioned earlier, there will be a regurgitation of blood into the left ventricle. Because of the total blood volume that is pumped into the aorta, the cardiac output will be reduced. Also, there will be pooling of blood in the left ventricle which eventually leads to the dilation of the left ventricle. Dilation of the left ventricle causes the heart to be mechanically less efficient. The overall reduction of cardiac activity will cause angina, cardiac arrhythmias, and dyspnea. Now, let's talk about the clinical features of aortic regurgitation. The clinical features are usually not present at the early stages of diseases and commonly seen at the severe stages. Most of the patients present with dyspnea, angina, and rarely with arrhythmias. On examination, the pulse will be a normal sinus rhythm, but it will be a large volume and a collapsing pulse. The pulse pressure will be widened. Pulse pressure is the difference between systolic blood pressure and diastolic blood pressure. In aortic regurgitation, the diastolic blood pressure will be low due to the backflow of blood. Due to left ventricular dilation, the apex beat will be displaced and diffuse. During auscultation, a murmur will be evident at the early diastole. This is caused by the regurgitant blood flowing through the defective aortic valve. Also, There can be an ejection systolic murmur caused by increased blood flow through the aortic valve during systole. This happens because of the large blood volume in the left ventricle. Rarely, there can be a mid-diastolic rumble which is known as the Austin Flint murmur. This murmur occurs due to the regurgitant jet affecting the mitral valve. There are specific signs that are observed in aortic regurgitation. However, keep in mind that these signs are not very common. Quincke's sign is capillary pulsation at fingernail beds. De Musset's sign is a nodding of the head with each heartbeat. In de Rosy's sign, there is a murmur heard at the femoral artery on auscultation. In Traub's sign, there are pistol shots-like sounds heard at the femoral artery on auscultation. Hill's sign is when the blood pressure of the lower extremity is more than the blood pressure of the upper extremity. Corrigan's sign referred to visible carotid pulse. In Mueller's sign, there will be pulsation of the uvula. The investigations that are done to identify aortic regurgitation are chest X-ray, ECG, echocardiogram, cardiac CT scan, cardiac magnetic resonance imaging, or CMR, and interventional radiological methods like cardiac catheterization. During the management of aortic regurgitation, the most important thing is to treat the underlying cause of aortic regurgitation. Pharmacological treatments such as vasodilators and inotropes will be useful in relieving symptoms of aortic regurgitation. However, aortic valve replacement surgery is the best treatment option for aortic regurgitation.
Hope you enjoyed the video and don't forget to like, comment and subscribe.